Welcome, my friends, to Dharma for Doctors, Spiritual Care for Caregivers. I am your host, Greg Holden. Joining me again is Daly the Dharma Dog, one of the young doctors who accompanied me on my rounds once told me she knew there were chaplains in the hospital and that she had called on them from time to time. But she added, "We don't have any idea what you do after you go in a patient's room." So that's the subject of today's talk, what chaplains do. I'm going to give you a little introduction to the kinds of spiritual care chaplains can provide, because some of these are things you can do yourself and for yourself. Which brings me to the first thing chaplains do: convey religious items. Patients who have to go to the hospital in a hurry don't always have Bibles or other sources of spiritual support with them. Bibles are very likely to be available in your spiritual care department or chapel. And sometimes I give patients tangible objects that I bless with prayers. These might be rosaries or prayer cards, like Our Lady of Guadalupe. There's also one of St. Peregrine, who is the patron saint of cancer patients, that I gave out quite a bit. I also handed out prayer shawls, which are made by volunteers who donate these colorful cloth coverings to our hospital. As they are knitted, the makers say prayers. So there are prayers literally knitted into each link of the fabric. And I would tell families that when I handed them out, and it was always very meaningful to them. The ritual of blessing or asking for blessings for an object or person or saying a prayer has great significance for individuals who have a well-developed sense of spirit or who follow a particular religion. It takes them out of their heads for a moment. It connects them to the wider universe outside the hospital. It's a gesture of respect and compassion. Which brings me to another thing chaplains do: rituals at the end of life. Prayer shawls are part of end-of-life care that chaplains provide. For hospital chaplains or hospice chaplains, it might involve sitting with a dying person and making sure they are not alone. Once there was a man in the ICU who had no family, no friends, and who refused cancer treatment and intubation. He just wanted to eat. I thought he exhibited great courage. I went and prayed for him, and he died shortly after, peacefully, just as he wished. There was a very bad house fire once, and 2 young men were critically injured and near death. I remember being called to say a prayer with the Spanish-speaking family, who were just beside themselves with grief, understandably. The interpreter and I squeezed into the little room in the burn unit with at least 20 people. The young man's mother, his siblings. It was so hot in there. I said prayers and invited family to say some words as well, and it was a very moving experience. So end-of-life care might take the form of a group prayer with family, or getting to know something about the dying person by encouraging family members to talk about his or her life. This is called life review or story therapy. In fact, what a chaplain hands out most often are prayers, or tissues to dry tears, or time to listen to the worries or fears of someone who is going through his or her own particular challenge. Time to listen. Time is one of the biggest blessings of being a chaplain. Doctors and nurses and CNAs are so busy. Chaplains are also busy sometimes, but we do have enough time to sit with patients for a half hour or more if they want. We have time to listen to what staff are going through too. In the medical system, it can be helpful to talk to your colleagues, but only up to a point. For many people, what's really helpful is talking to someone who is outside of the system and who has a different perspective. A particularly good approach to attending to patients' concerns is called active listening. Active listening is where the listener suspends his or her urge to respond to someone and who devotes full attention to the person who is talking. This encourages that person to talk more and access deeper and deeper levels of experience. Doctors sometimes call this active listening magic when performed by one of the palliative care physicians I worked with. Through actively listening, chaplains can perform a spiritual assessment. In a spiritual assessment, the chaplain gathers basic information such as the person's faith tradition, whether or not they have a spiritual community, and how important a role spirituality plays in his or her life. They also evaluate and address signs of a spiritual distress or struggle. A chaplain might also do referrals to specialists such as priests or rabbis or imams or the minister of the patient's home church. Priests and other ordained ministers are authorized by their denomination to perform special rituals like confession or communion or anointing of the sick. Above all, chaplains extend compassion and empathy to patients. It's part of showing what used to be called the milk of human kindness. I used to give a talk every month to residents doing a rotation in the medical ICU. I once mentioned something about vibration and how different people give off different vibrations or vibes. You give off very good vibes, don't you? One of the doctors said, "Yes, I can tell. You chaplains have a different vibration than we do. It's lower. I just feel calm being around you." That's one thing chaplains do. They promote a calm presence to whatever environment they are in. Chaplains aren't doctors or nurses. Oftentimes, patients told me they were glad to see me specifically because I was not a doctor. I could connect to them on a different level, a human and a spiritual level. That brings me to the button I'm wearing. I wanted to give you a little closer look at the button I wore around the hospital during the pandemic. This is more or less how I looked. People would see the mask, but then they would also see the smiling face. And I cannot tell you how many positive comments I got, not only from patients, but from staff. Just think what the experience is like for patients in the hospital as they are attended to by all these people wearing masks. It might be reassuring for some, but I have no doubt for most patients it is scary. This button lets people know that there's a human being behind this mask and someone who has their interest at heart. So thanks to Dr. Lisa Gopi for this. One of the palliative care physicians I worked with, this was her idea. And there's nothing preventing you from doing the same thing yourself. Go bake a button and show people who you are. The most important things for me as a chaplain in the hospital were to listen, to affirm a person's experience, to acknowledge what they were going through, and to respect them. Beyond that, if I could send them empathy or even a little love and connect them to the wider universe through prayer, so much the better. Chaplains represent the world outside the hospital, the so-called real world. For individuals who have been in the hospital for weeks or even months at a time, we can be a reminder of what is out there and what they, the patients, can get back to. If you're a doctor or nurse, I know what you're thinking. That's great for you, chaplain, but what can I do? I don't work in the real world. I work in this place. You are so wrong if you think that. Just by being human and real and compassionate, you remind people of being around their friends and family and their other communities. You can do this. I want to end with a little intention. You can call this a prayer. You can call it a meditation. Sit for a moment with your back straight and just breathe. Breathe in all the caring you have shown to yourself by taking these few moments to listen to me and to learn something new. Feel good that you are caring for yourself in this way. Think about your own metaphorical smiling face button. This is your humanity, as you go around the hospital or the nursing home or the place where you work, may you never lose touch with that humanity. May you never forget the humanity of your patients. We are all connected by the cord of humanity, and we are all dependent on one another. Go through the rest of your day and carry that smiling face, that humanity around with you. You have your professional role, and you have your caring, beautiful, loving self too. These two do not need to be separate. They inform one another, and by working together, they will make your caregiving that much better. This is Chaplain Greg Holden, and you've been watching Dharma for Doctors, Spiritual Care for Caregivers. Please subscribe and leave me some comments below, and like this video if you are so inclined. Thank you so much for listening. I wish you blessings and peace.